What's up, y'all? Today is March 29, 2020. I'm your host, What's His Face, and as a Georgia State resident, I have been deeply concerned with how our state has been handling the response to COVID-19 from the start until now. That's exactly what we're going to be taking a look at in today's video. You are watching Inspiring Inquiry. In the United States, Georgia is home to 10.52 million Americans. Just like the rest of the country, or world for that matter, we are deeply concerned for our well-being and that of our family, friends, and neighbors. Chiefly among them, our most vulnerable population. What steps has Georgia and its authorities taken to combat this new threat and protect its citizens? In this video, I will be going over the parts I feel will impact the average citizen the most and omitting those directed at corporations or that of the state, county, or local official departments. Links to full listings will be provided in the description below. Like other places in the US, it started when on March 14th, our state governor, Brian Kemp, instituted the first ever, in Georgia's history, executive order to declare a public health state of emergency, following the president's national declaration the day before. Unlike other states of emergency that we may be more familiar with, like ones for flooding or hurricane evacuations, a public health state of emergency allows the Georgia Emergency Management and Homeland Security Agency to lead, in concordance with the Department of Health, to take specific actions in order to protect the public at large from a health emergency. Actions like freeing up $100 million in funding, lifting state restrictions like allowing temporary licensing to medical staff, or lifting operation limits usually enforced on commercial motor vehicles. It also compels all state and local, public or private, hospitals and healthcare facilities to fully comply with the orders given by the governor, as well as the planning and executing of public health emergency assessments, mitigation, preparedness response, and recovery for the state. Instead of reading all 9, I'll post them on screen now for you to see. It also allows for protections against the price gouging of goods and services necessary for public health, which would otherwise be detrimental to the social and economic well-being of the people. Later that evening, he took further action through the Georgia Department of Defense to provide up to 2,000 National Guard troops to help in response to the emergency. In his address to the public, Governor Kemp stated this information and also said that after speaking with Georgia's leading medical experts, they all recommend, and I quote, immediate implementation of social distancing measures to flatten the epidemiological curve for exposure and to mitigate patient surge at healthcare facilities, otherwise we risk a run on critical resources for the sickest patients in our state. Now is the time to act, end quote. Following that, he also stated that elderly citizens and those with underlying health conditions face serious threat, and we must do everything in our power to reduce risk associated with the virus. He also asks that we remain supportive of one another, be mindful of exposure, and use best practices to prevent infection. On March 16th, the governor closed public elementary, secondary, and post-secondary schools around the state to remain closed until March 31st or until further amended. On March 20th, an executive order allowed further suspensions on regulatory processes in order to better execute necessary measures in response to the pandemic, adopting emergency rules to provide telemedicine licensing and asking pharmacists to provide early refilling, as well as a 90-day supply of medications excluding Schedule II substances. Suspending codes that in doing so will permit capable facilities to expand capacity, offer services, or make expenditures necessary to assist with the needs of the public health state of emergency. Department of Community Health required healthcare facilities and providers to report on an as-need basis the actions taken to assist in this effort. An amount of $19,552,646 was transferred from the governor's emergency fund and credited to appropriation accounts, covering costs associated with this pandemic.
Will plant nurse please report to column B77?
March 23rd. Further suspensions of medical licensing were issued, allowing licenses that have lapsed in the past 5 years with no history of administrative action against them, but also limiting it to the medical treatment of victims of the existing public health emergency and only for the duration of the order, including granting temporary licenses to graduate nurses that have yet to take the license exam, granted they work under a licensed nurse during the duration. With the power vested to them by the declaration of a public health emergency, the Department of Health ordered certain persons within Georgia who have serious underlying conditions likely to spread the virus, if they are infected, to isolate, quarantine, or shelter in place, with provisions to allow persons quarantined to seek essential services, make necessary travel, and receive visitors in end-of-life circumstances. It also closed businesses defined as bar while limiting open establishments and businesses to a less than 10 occupancy rate, unless they can remain 6 feet apart per social distancing guidelines. Lastly, a public information campaign was launched to encourage businesses to undertake more extensive sanitation efforts, curbside or delivery of purchased items, and to limit personal interactions as much as possible. On March 24th, restrictions were enabled on parents and guardians, limiting their access to child care facilities to the front door or waiting area in compliance with social distancing, while suspending other restrictions by waiving the rule that 50% of child care staff must be CPR trained to a rule of 1 staff member being certified, as well as waiving some requirements in order to assist parents with getting immunizations. Lastly, in compliance with social distancing guidelines, that field trips shall no longer occur. On March 25th, an order was signed extending renewal requirements and expiration dates on Georgia state driving licenses and identification cards, as well as doubling the check-in requirements for those with interlock systems on their vehicle. March 26th, there was a further extension of school closures from March 31st to April 24th for in-person primary and secondary schools. Public, post-secondary schools shall remain closed for the rest of the semester, leaving the university system and technical college system of Georgia up to the chancellor and commissioner of each system. This does not affect remote learning. Also, it authorized the Commissioner of Labor to implement emergency rules with respect to deductible earnings for the employment insurance claims filed on or after March 14th, to provide economic relief to individuals unemployed through no fault of their own, while lifting the maximum amounts allowed to be granted and instituting a new limit. March 27th. On the 27th, the State Board of Education waived state rules, regulations, policies, procedures, and provisions, as well as extending annual requirements for educational school boards from 2020 to 2021. From March 14th to the 28th, for better or worse, these are the actions taken by our state officials. For more information, you can always go to gov.georgia.gov. For those in Georgia experiencing symptoms or those who have been exposed to someone with symptoms, please contact Georgia's COVID-19 hotline with the number posted on screen. Thank you for watching, and please go wash your hands.